on.
Let's talk about sex, baby.
First of all, let's talk about taking care of your sexual health. You need regular checkups for your sexual health just as much as any type of health care.
We are going to go through a couple key exams that you should start thinking about. We'll mention at what age you should be getting them, how often, where, and what they will be looking for. For women, you should start thinking about a breast exam in your 20s and 30s. You should be getting them every year to every 3 years, depending on your doctor's advice. As a form of early detection of breast cancer, a breast exam checks for changes and lumps in your breasts. You can get a breast exam at your women's doctor's office or a gynecologist's office, along with a pelvic exam, which we'll talk about next. You don't need to start worrying about a mammogram until you are in your 40s, and that will happen every year. It is important to notice changes in your breast yourself.
A pelvic exam is commonly known as a Pap test. However, a pelvic exam encompasses that Pap test. A pelvic exam is when your internal and external reproductive organs are examined. It includes a Pap test, which is just a simple swab that looks for cervical and vaginal cancer cells. You should start getting them 3 years after your first sexual contact. This does not mean just sexual intercourse. It really means anything below the belt. If you have not had any sexual contact, you still need to start having pelvic exams at 21. It will be done once a year until your gynecologist tells you otherwise. You can have them done at a women's doctor or gynecologist office, as well as some clinics.
For men, you should start talking to your doctor about testicular exams when you're around 15. They will tell you when they think it is necessary for you to start them. You'll get a testicular examination every year with your annual checkup, and you can also check them regularly yourself. Ask your doctor to show you how, as well as how often they recommend it. Testicular cancer is most frequent in young men ages 20 to 35, so it is important to start thinking about it.
A prostate exam is one exam you guys don't have to worry about until you're around 50, when you should be getting one every year. It involves a rectal exam that looks for lumps that have developed in the prostate, which can lead to prostate cancer.
Now we are going to be talking about testing for STIs. STI is short for sexually transmitted infection. They used to be called STDs, as I'm sure you've heard, but infection is a more encompassing term than disease is, and so it is more medically correct.
You should start being tested when you are sexually active. Again, this does not just mean sexual intercourse. The frequency of your testing depends on the amount of sexual partners you have and your safer sex practices. A good start point would be to go in and talk to your doctor, either with a specific appointment or at your next yearly checkup. Both doctors' offices and clinics have testings for STIs.
You will not be automatically checked for STIs at a PAP or a physical, so you'll need to ask for the physician to include it. As different STIs require different exams, there is not one exam for them all. Different tests include a physical exam, blood sample, urine sample, or a discharge, tissue, cell, or saliva sample. These look for more common STIs, such as HIV, chlamydia, gonorrhea, herpes, and HPV.
It is important to remember that STIs can occur in relationships of all sexualities. As some STIs only require skin-on-skin contact to transfer, it doesn't matter if you are straight, gay, bisexual, or anything else. This is why testing is important to consider when you have engaged in activities other than sexual intercourse. Remember, condoms are the best prevention against STIs. However, just like with preventing pregnancy, they are not 100% effective. That is why you still need to get tested even if you always use a condom.
We have put together the most accurate information we could find. However, each of you has different health concerns, so always check with your doctor first. This is just meant to serve as a starting point and a way to get you talking. The clinic on campus offers all the testing we have gone over, so feel free to give them a call if you're looking for more information or an appointment.
On a final note, it might be a bit scary to think of these things, but it is important to be proactive. Even though these exams can be a bit awkward, just remember that everyone gets them done, and your doctor has probably seen it all. As we have mentioned before, it is important for you to keep an eye out for changes in your sexual health on your own, just like you would with the rest of your body.
Thank you for watching.
Remember, the better your sexual health, the better sex you'll have.